wonderful to be here, and I mean that in the most sincere way. I'm going to be talking about a little bit about the future of the physician and the future of healthcare, and I'm quite accustomed to talking to groups that are resistant to change, and so it's really exciting to be among the people who are actually making the change here, and it's reassuring. What I want to talk about over the next 15 minutes is basically how the role of the physician is changing dramatically. I think this is probably a talk that you wouldn't hear anyplace else, and I want to give you guys something a little different. I think it's important because so many of us, especially my physician peers, we spend so much time on the granular aspects of healthcare that we spend very little time panning the camera back to see exactly what's happening to our profession, and it's changing really dramatically. So I just want to open up with this little diagram, which comes from David Armano, and it's reassuring to me because it tells me that I'm more trusted than a social media consultant, and a banker, and I guess a snake oil salesman. So I've got that going for me anyway. Recently, I saw a young girl in my office. She had presented to me, I'm a pediatric gastroenterologist, with chronic vomiting. And we jumped into sort of the initial evaluation. We didn't figure out what's going on, and she ultimately came to endoscopy where her small bowel or her duodenum showed a real intense infiltrate with a cell called an eosinophil. Okay, an eosinophil is a type of white blood cell that we sometimes see with allergies and parasites, but in kids it's often the first responder in inflammatory neuropathies of different kinds. So I got the biopsies and I called Mom, and about 20 seconds into the conversation, Mom interrupted me and she says, "You know, Dr. V, you don't need to go any further, just spell eosinophil for me if you would." So those of you who laughed probably know exactly what this mom was doing. She wanted to get off the phone with me so that she could go on the internet and do her own research. Okay, and this little vignette, as simple as it sounds, encapsulates beautifully the changing relationship that doctors and patients share. Perhaps most importantly, it tells us about the information that patients now share with their information. Okay, access to information is completely revolutionizing the way patients see themselves, the way they see their diseases, and the way they see me, their doctor. So how have we got to the point where we had Marcus Welby in the mid-20th century, and up to now where we have a mom who doesn't want to listen to what I have to say, or wants to move on to something different? Well, this is what I call the Tower of Empowerment, which some of you have seen if you've heard me speak, but it basically outlines what's happened over the past decade, 10, 15 years, in healthcare. And so long ago, for generations, if not centuries, patients, when they were sick, they came to the doctor, you would tell them what's going on, they'd tell you what to do, and you'd leave and you'd do it, right? Okay, well, that all changed in the early 90s with the internet. Patients actually had access to information, right? We had the schmaltzy websites with the hyperlinks, and so patients, for the very first time, could get the same information that we had. Okay, and that evolved. Things evolved into the 2000s, where patients started to find one another through loose social networks. Okay? Also in the 2000s, we saw the advent of movable type, and patients could actually become publishers, not only just recipients of information. And then finally, what we see now with social networks is information finds patients in their social networks. Contrast that with the early 1990s, where patients went to Google to find their information. It's the exact opposite. Okay, so through this whole evolution of social health, physicians have been quiet spectators. Okay, we have been absent from the conversation to some extent. We're getting into it now, but what people like ePatient Dave and the other e-patients who are here today are doing is they are redefining us, the physician. Okay, and so there are a number of forces that are redefining the physician. I just want to go through 3 of them today, just to give you an example of how this change is happening. And the first force changing the MD, of course, is technology. Now more than ever and going forward, a lot of what doctors did and will continue to do with their hands and eyes and minds has been replaced by technology. Okay? In the 20th century, we treated symptoms, or the 19th century, we treated symptoms. 20th century, we treated diseases, and in the 21st century, we will predict and preempt and prevent disease. Okay, and that's all because of technology. So what's going to happen to the doctors there? Another force changing us. is third-party control. Okay, what I do is increasingly coming under administrative control, okay, through evidence-based initiatives, managed care. These other things are minimizing my independence, okay? And that may not be such a bad thing when you look at the left side of the slide. That technology that you see over there, for the time being, is quite expensive, so we need some check on that technology. So third-party control is changing me. And then finally, the crown jewel is Health 2.0. Okay, for the majority of civilization, up to the start of that tower that I showed you a little while ago, physicians have had a stranglehold on knowledge and information. But that's all changed now. Okay? We're witnessing a type of healthcare disintermediation. As Esther Dyson says, the beauty of the internet is it sucks power out of the center and pulls it out to the periphery, and that's exactly what's happening with the doctor-patient relationship. Okay, when a patient comes to see me, that face-to-face interaction with the doctor is evolving as a much smaller slice of what a patient does on their quest to get better. So through all these forces we see here on the slide, we sort of see a confluence of social and technological forces that are completely conspiring to redefine the physician. I posted this on my blog some while back, and someone said, you're a crybaby and you're complaining. And I'm not. I'm saying this is progress, but it's just change. It is change. If you want a great example of how technology can redefine physicians, we probably don't need to look any further than the stethoscope. That's the venerable icon of the physician, right? When we think of the doctor, we think of the stethoscope. Well, in 1816, when the stethoscope was invented, it was completely disruptive. It was transformative. Okay, at that point in time, doctors developed the capacity to correlate body sounds with things that were happening inside of a patient. Okay, for generations, if not centuries, doctors were sort of at the whim of what happened on the outside, and for the first time, doctors had some control of predicting and telling what was happening and having the ability to intervene. The mid-1800s is when we went from observing patients to examining patients, and it was a critical point in the history of medicine. The stethoscope continued to define us between the mid-1800s into the early 20th century. It just led us in the direction of diagnostic medicine. If we wanted to think about, look into the last century, we can think about, this was probably the last time, sometime in the mid-1900s, where the stethoscope really kind of lost its real usefulness at the bedside, so to speak. This study from Mangione, done in 1993, looked at the use of the stethoscope by physician training programs and how effective it was, and they found some pretty alarming findings. Only 37% of cardiology programs were actually teaching auscultation. That's the use of the stethoscope. And the median accuracy of cardiology trainees was only 22%. And the skill of resonance was no better than that of medical students. So it appears if we really wanted to be skillful as physicians with the stethoscope, there may be no one to teach us how to use it. And even if we did use it, or did learn how to use it, we wouldn't use it enough to really be good at it. Okay, over the course of the 20th century, other technologies evolved and developed that replaced the bedside diagnosis where we use the stethoscope. Let me just go back to a little, I caught a little quote here. I've looked at this paper a number of times, and it wasn't until I made the screen grab for this presentation that I noted this little quote up here, down in the lower right by Paul Wood. I'm going to read it. It said, "There's already plenty of evidence to show that we're in danger of losing our clinical heritage and pinning too much faith in figures thrown up by machines. Medicine must suffer if this tendency is not checked." And that was written by Paul Wood, who was a master cardiologist in the UK in the 1950s. What you see there is sort of fear by a physician of the impending effect of technology. And that will continue and will continue. Despite Dr. Wood's concern, technology continues to be responsible for a lot of the diagnosis that we a lot of the diagnoses that we make as physicians, and consequently it's changing the way we work. Clayton Christensen and Jason Wang, who wrote The Innovator's Prescription, have a couple of terms to describe the spectrum of thought in medicine, and I think it's worth discussing them. Now, the first type of medicine they describe is intuitive medicine, and that's how doctors solve medical problems using patterns and symptoms. Okay, this is the art of medicine where we react to certain things and we experiment. Now contrast that with precision medicine. Okay, precision medicine is when a doctor uses technology to make a specific diagnosis based on the cause of a patient's disease, not just their symptoms. Okay, on the left we see 19th and 20th century medicine, okay, the art of medicine. On the right we see 21st century medicine and where we're headed. I wrote about this in my blog, 33 Charts, and this was very recently, and Jason Wang, who is the author of Innovator's Prescription, actually read the post and left a nice 500-word comment. And this is one of the great things about blogging is you write something and these authors find you, and it's amazing. So he said this: there's a passive-aggressive-like tendency for intuitive experts to demand the development of tools that make their lives easier, yet disparage them should they feel threatened with disruption or obsolescence. Isn't that amazing? And that's exactly what I face every day in the doctor's lunchroom when I talk to my physician peers about the future of medicine and the future of technology. Every time I bring up a technology, there is a but, and all this centers around the fact that we want this precision, but we really want to believe that we can still do it with our hands. Okay? And so it leads to some very, very interesting questions, namely, what's going to happen to me in the future? What's going to happen to the next generation of physicians? Okay, people Ken talked a little bit about robots and artificial intelligence, something I think about all the time. But I think going forward, what we're probably going to see is a massive redefinition of the physician. We're not going to be replaced, but we're going to be redefined. And we have to participate in that redefinition. All those forces that I pointed to that are changing the doctor, how we react to those is going to determine what we're going to be in the generation ahead. Okay, and finally, I think we really have to think about our educational system. We have to revamp that in a way that's consistent with the current modality of medicine, and certainly change it in a way that's consistent with the needs of our current e-patients. Thanks.